Have you ever wondered if the way you masturbate after 60 could actually be harming your erections, disrupting your sleep, and quietly weakening the very parts of your body you're trying to protect? Most older men never question this habit. They assume that if masturbation helps them fall asleep faster, then it must be harmless. But the truth is far more complex. After 60, your body changes in ways that directly affect your erection, your penis sensitivity, your hormones, and even the way your brain processes sexual stimulation. And when you combine those changes with outdated techniques, rushed movements, or the wrong type of pressure, what once brought relief can start creating silent damage. I'm Dr. Emilly Collins, a urologist who has spent years helping men over 50 and 60 understand how their nighttime habits, especially masturbation, interact with their vascular health, nerve pathways, and sleep cycles. And one of the most surprising things I tell my patients is this: masturbation is not the problem. The problem is how you masturbate. After 60, certain positions restrict pelvic blood flow. Certain grips reduce long-term nerve responsiveness. Certain routines overstimulate your brain at a time when your nervous system is trying to power down for deep sleep. And many men unknowingly train their penis to respond only to patterns that slowly undermine erection quality. When you're older, every choice you make around stimulation affects circulation to the penis. Nitric oxide production, the flexibility of the arteries that support erections, and even the hormonal rhythm that prepares your body for restorative sleep. That means the habit you've used for decades might now be interrupting your brain's transition into rest, tightening pelvic muscles that should relax, and creating microtensions that weaken your natural arousal signals over time. You may think you're helping yourself unwind, but your body may be quietly paying a price. And this is why. Understanding what happens inside your body during nighttime masturbation is essential. The more you understand the connection between stimulation, blood flow, nerve activity, and sleep cycles, the easier it becomes to protect your erections, your energy, and your confidence as a man. You've probably felt some of these changes already. Maybe erections fade faster. Maybe climax feels different. Maybe sleep doesn't feel as deep as it used to. All of these signs matter, and your body is asking you to pay attention. Before we continue, let me ask you something important. Have you ever noticed your erection or your sleep getting worse after certain nights? If that resonates with you, leave a comment and share your experience, hit like so this message reaches more men who need it, and make sure you're subscribed so you don't miss what comes next, because what you're about to discover may surprise you and help you finally understand the signals your body has been sending. Now let's move forward and break down exactly how your body changes after 60 in ways most men never realize. As your body moves past 60, the changes happening inside you are not random or mysterious. They follow a biological pattern that affects everything from your erection strength to how your penis responds to touch, to the way your brain prepares for sleep. And when these changes meet long-held habits of masturbation, especially habits developed decades ago, the impact becomes even more pronounced. The first major shift is circulation. Younger men produce nitric oxide easily, allowing blood to surge into the arteries of the penis with little effort. After 60, however, nitric oxide levels naturally drop, the endothelial lining becomes less flexible, and the small vessels that support erections respond more slowly. This means that the penis needs gentler stimulation, more patience, and a rhythm that aligns with a slower vascular response. Fast, aggressive, or highly repetitive movements can overwhelm the system and leave you wondering why things do not work the way they used to. Another major shift is nerve sensitivity. The penile nerves that once fired instantly now require more deliberate stimulation. Many older men misinterpret this as losing sensitivity, when in reality the nerves simply need more time and less friction. A tight grip or high pressure, especially late at night, can desensitize these nerves even further, creating a vicious cycle where you need stronger stimulation just to feel normal. This deeply affects your ability to maintain an erection during sex as well, because your penis becomes conditioned to respond only to intense solo stimulation rather than natural touch or intimacy. Hormones also play a powerful role. Testosterone doesn't disappear after 60, but its pattern shifts from spontaneous peaks to more subtle waves. Instead of sudden bursts of desire, your brain relies more on relaxation, emotional safety, and proper blood flow to activate arousal. When you masturbate at night with tension in your body, poor posture, or anxious thoughts, it interferes with the hormonal environment needed for both erection quality and healthy sleep. Your adrenal system stays activated, mixing sexual stimulation with stress responses, and your brain struggles to transition into deep sleep afterward. Sleep cycles themselves become more fragile. After 60, your brain enters lighter stages of sleep more easily, and it takes longer to reach the restorative phases where testosterone production increases, where the penis receives natural nocturnal blood flow, and where your nervous system resets. If masturbation is rushed, forceful, or done in a way that overstimulates the brain, you may fall asleep, but you won't fall into the deep recovery cycle your body desperately needs. Over time, this contributes to weaker erections, decreased libido, and difficulty feeling rested in the morning. Even your pelvic floor changes. With age, the pelvic muscles tighten more easily, especially if you sit for long periods or sleep poorly. Masturbation done in certain positions can activate these muscles in a way that interferes with circulation to the penis, creating subtle tension that affects both erection quality and the release of sexual energy. All of these internal shifts, circulation, nerves, hormones, sleep, and the pelvic floor, interact every time you touch yourself. Understanding them is the key to adjusting your habits so your body works with you, not against you. And now that you know how these changes develop, the next step is recognizing how certain techniques you've used for decades may be unintentionally making everything harder rather than helping you unwind. Once you understand how the body shifts after 60, it becomes much clearer why certain masturbation techniques that worked perfectly in your younger years can now quietly work against you. Most older men never realize that the habits they repeat night after night are directly shaping the way their penis responds, how their erection behaves, and even how their brain transitions into rest. One of the most common mistakes is using pressure that is simply too strong for an aging circulatory system. A tight grip can compress the tiny blood vessels in the penis, reducing natural blood flow and training the tissue to respond only when stimulated with force. Over time, this creates a pattern where lighter, more natural touch feels weak or uninteresting, making partnered intimacy more difficult and increasing dependence on solo stimulation. Speed is another problem. Rapid movements may have felt exciting in your 20s or 30s, but after 60 the nerves need steady, rhythmic stimulation to fully activate. When the motion is too fast, the brain cannot synchronize arousal signals with physical response, and you may feel detached from the sensation or frustrated by how quickly the erection begins to fade. This disconnect between brain and body can silently erode confidence, making you believe something is wrong with your desire or masculinity, when in reality it is simply a mismatch between your technique and your biology. Posture plays a role as well. Many older men masturbate in positions that restrict pelvic blood flow without realizing it. Hunched forward, sitting on the edge of a bed, or leaning awkwardly in the dark, all of these positions tighten the pelvic floor and compress nerves that support erection strength. When this becomes a nightly pattern, circulation becomes less responsive, making it harder to achieve or maintain firmness. Even the way you breathe during stimulation matters. Shallow, tense breathing reduces oxygenation and increases stress hormones, which interfere with both erection quality and the brain's ability to settle into deep sleep afterward. Another subtle but damaging habit is overstimulation of the glands, the head of the penis. As men age, the glands becomes more sensitive to friction but slower to register pleasurable signals. Excessive rubbing or repetitive friction without proper lubrication can irritate the tissue, reduce sensitivity over time, and create lingering discomfort that affects arousal the next day. This irritation can also disrupt the sleep cycle because the nervous system remains slightly activated rather than calming down. Repetition is perhaps the most powerful factor. When you masturbate the same way every night, same grip, same rhythm, same speed, your brain and penis become locked into a narrow pattern of arousal. This creates a kind of conditioned response in which only that specific stimulation produces results, and anything outside of it feels weak or unresponsive. As circulation slows with age, this conditioning becomes even stronger, creating a dependency that limits your ability to enjoy sex naturally and makes your erection increasingly fragile. These habits don't necessarily feel harmful in the moment, but their impact accumulates over time. The good news is that once you identify which patterns are interfering with your erections, sensitivity, or sleep, you can begin adjusting them gradually. And in the next part, we'll explore how these repeated mistakes affect not just your penis, but your nervous system, your hormones, and your overall nighttime recovery, revealing how much your body is trying to communicate through these subtle changes. As these habits repeat themselves night after night, their impact goes far deeper than the surface of the penis. They begin influencing your nervous system, the chemistry of your brain, and the way your body transitions from sexual stimulation into sleep. One of the most overlooked consequences is how a repetitive or overly intense masturbation pattern can alter the way your brain processes arousal. When you rely on high pressure, fast motion, or specific techniques, your brain starts to expect a level of stimulation that becomes increasingly difficult to recreate naturally. This reshapes your arousal pathways, making spontaneous erections rarer, weakening nighttime erections, and causing the penis to feel less responsive. What many men interpret as age catching up is often a nervous system conditioned into tension rather than relaxation. These patterns also influence hormone rhythms, especially at night. After 60, your hormonal balance becomes more delicate. Testosterone rises and falls in subtler waves, and your body needs calm, steady signals to support arousal and recovery. When masturbation is rushed, aggressive, or mentally overstimulating, your adrenal system stays partially activated, releasing cortisol instead of allowing testosterone to guide your body into a restful state. This not only affects your erection quality but also disrupts the hormonal sequence that helps rebuild energy and cellular repair during sleep. Over time, this leads to waking up tired, feeling mentally foggy, and noticing a gradual decline in libido. Another layer involves the pelvic floor. These muscles are critical for erection strength, ejaculation control, and bladder function, but they also react strongly to stress. As men age, the pelvic floor can become overly tight rather than weak, especially if the posture during masturbation compresses the pelvis or narrows circulation. Tight muscles restrict blood flow to the penis, reduce the intensity of climax, and create lingering discomfort afterward. This tension can stay active even during sleep, subtly interfering with your ability to rest deeply and causing the body to remain in a semi-alert state. The next day, this shows up as less energy, reduced motivation, or a feeling of heaviness in the pelvic area. Your brain's sleep architecture is also affected. After 60, your body shifts more easily into lighter sleep stages, and anything that heightens nervous system activation makes it harder to reach the deep, restorative phases where testosterone is produced. Erections are naturally rehearsed through nocturnal tumescence, and tissues repair themselves. If masturbation involves too much friction, too much speed, or too much mental stimulation, your brain remains in a heightened state long after the climax fades. This makes it harder to fall asleep fully, and even if you do sleep, you'll pass through the night without accessing the deeper cycles your body depends on for hormonal renewal, emotional balance, and vascular health. Even the emotional layer matters. When men begin to notice that their erections are weaker, their sensitivity lower, or their sleep disrupted, they often internalize the problem as a personal decline rather than a pattern their body has been trying to adapt to. This creates subtle anxiety, a quiet tension that follows you into the bedroom and into your nightly routine. That emotional layer tightens the pelvic floor, restricts blood flow, and sends mixed signals to the nervous system, reinforcing the very cycle you're trying to break. But the encouraging truth is that none of this is irreversible. Once you understand how these patterns form, you can begin shifting your approach in a way that aligns with your body's natural rhythm. And the next step is to understand how these accumulated effects can escalate into more serious risks if the habit isn't adjusted. As these patterns accumulate over months or even years, the risks begin to extend far beyond temporary frustration or weaker erections. For men over 60, the wrong masturbation habits can quietly affect the structural health of the penis, the resilience of the vascular system, and the stability of the pelvic region. One of the most significant yet invisible risks is the development of microtrauma in the penile tissue. When you apply excessive pressure or repeat the same friction-heavy technique night after night, the tiny blood vessels inside the penis become strained. These vessels are already more fragile with age due to reduced elasticity, and repeated stress can cause subtle damage that limits how well blood flows into the erectile chambers. At first, this may feel like slower arousal or difficulty maintaining firmness, but over time it contributes to the progression of erectile dysfunction in ways most men never connect to their nightly routine. There is also the issue of nerve desensitization. The nerves of the penis are incredibly delicate, and as men age, they lose some of their natural speed and sensitivity. When exposed to high-intensity stimulation, especially without proper lubrication, these nerves can become overstimulated to the point of numbness. At first it shows up as needing stronger touch to feel the same level of pleasure, but gradually it leads to a reduced overall response. Partnered intimacy becomes more difficult because the penis has been conditioned to respond primarily to harsh or highly specific forms of stimulation. This drift away from natural touch can create a sense of disconnect during sexual moments, deepening feelings of insecurity or confusion. Another silent risk comes from the pelvic floor. Many older men assume pelvic problems are caused by weakness, but excessive or tense masturbation routines can actually tighten the pelvic floor excessively. This tension can trap nerves, limit circulation, and create a persistent ache or heaviness in the area. It can also affect ejaculation control, making climax feel forced, weak, or difficult to achieve. For some men, this tension leads to a cycle where arousal becomes mentally strong but physically limited, causing the body to respond with frustration, interrupted stimulation, or even discomfort during climax. Circulation in the pelvis is also deeply affected. After 60, many men experience slower blood flow due to natural changes in their arteries. If the masturbation technique restricts circulation or compresses sensitive pathways, the pelvis receives even less oxygen and nutrient-rich blood. This not only affects erection quality but also interferes with the natural nighttime blood flow patterns that help keep the erectile tissue healthy. Reduced nighttime circulation accelerates age-related changes in the penis and can create a long-term pattern where erections become softer, shorter-lasting, or harder to initiate. An overlooked but meaningful risk involves the nervous system. When masturbation becomes a compensatory habit for stress or restlessness, especially before bed, the brain may begin to associate sexual stimulation with tension rather than release. Instead of guiding the body into relaxation, the pattern can activate alertness, causing the nervous system to remain wired long after stimulation ends. For older men who already experience lighter sleep cycles, this can worsen sleep quality and reduce the restorative depth of rest needed for testosterone production and penile health. All of these risks develop quietly, and they rarely present themselves dramatically at first. Instead, they accumulate gradually, creating a steady decline in sensitivity, circulation, and confidence. But the encouraging truth is that once you recognize the mechanisms behind these changes, you can begin shifting your habits in ways that protect both your sexual health and your sleep. And the next step is understanding how to make those adjustments effectively, in a way that works with your body rather than against it. Understanding the risks is the first step, but the real transformation begins when you start adjusting your habits in ways that support your erection, your sleep, and the natural rhythm of your body after 60. One of the most important changes is learning to work with your circulation instead of against it. Because blood flow responds more slowly with age, deliberate stimulation becomes far more effective than rushed or forceful movements. Gentle pressure encourages the arteries of the penis to expand rather than collapse under tension, and this shift alone can dramatically improve how responsive your erection feels. Instead of gripping tightly, easing into stimulation allows your body time to warm up, letting blood settle into the tissue and creating a firmer, more sustainable erection without overwhelming the delicate vessels that support it. Another adjustment involves your breathing. Many men masturbate while holding tension in their chest, shoulders, or abdomen, without realizing that shallow breathing limits oxygen flow and activates stress pathways that work directly against sexual arousal. Deep, slow breathing helps relax the pelvic floor, improves circulation to the penis, and reduces the neurological tension that interferes with sleep afterward. The more your body relaxes, the easier it becomes for nerve signals to transmit pleasure, making the experience more satisfying without the need for excessive friction or intensity. Positioning also matters. Certain postures compress the pelvis, reduce sensation, and push the body into unnecessary strain. Lying back with proper support or reclining gently allows the pelvic muscles to loosen, giving the nerves and blood vessels room to function freely. This is especially helpful for men who experience aching, heaviness, or difficulty maintaining an erection during stimulation. When the pelvic floor is no longer clenched, the penis receives fuller blood flow, resulting in a more natural and stable response. Pacing is another powerful tool. Instead of stimulating continuously at the same speed, adopting a slower rhythm with variations gives your body time to process sensation and build arousal gradually. This retrains the nervous system to respond more naturally, breaking the dependency on intense friction patterns that often lead to weaker erections over time. Slower pacing also helps your brain stay grounded rather than overstimulated, which makes it easier to transition into sleep rather than fighting against a surge of mental activity after climax. Lubrication becomes increasingly important with age as well. The skin of the penis becomes more delicate, and dryness can cause microfriction that irritates the tissue and reduces sensitivity. A small adjustment in lubrication can dramatically change the quality of stimulation, making it smoother, safer, and more aligned with the body's needs after 60. This simple change helps prevent irritation, preserves nerve responsiveness, and creates a more pleasurable experience overall. Another essential shift is reducing the mental tension often associated with nighttime. Masturbation. Many older men carry stress, restlessness, or emotional weight into the moment without realizing how directly this affects their arousal and sleep. Approaching stimulation with calmness rather than urgency allows the brain to settle, creating an internal environment where both erection and rest become more accessible. When your body is guided gently rather than pushed, the experience becomes not only healthier but far more satisfying. All of these adjustments work together to restore balance, protect your sensitivity, and support deeper, more restorative sleep. And once these foundations are in place, something important happens. Your body begins responding more naturally, your erections feel stronger, and your confidence grows. With this foundation established, we can now close the journey by bringing all insights together and guiding you into the final phase of understanding, where the improvements become part of your nightly routine and the benefits extend into every area of your life. When these adjustments become part of your routine, something subtle but powerful begins to happen. The tension that once sat quietly in your pelvis starts to release, the sensitivity that felt dull begins returning in small but meaningful ways, and your erection no longer feels like something you have to chase. Instead, your body responds with a steadiness that feels more natural, more aligned with who you are now, and more in tune with the rhythm of a man who understands his own physiology. This shift is not about forcing your body into performance, it is about giving it the environment it needs to work the way it was always meant to work, even after 60. As these changes settle in, the connection between your mind and your penis becomes clearer. You begin to notice how your breathing influences arousal, how the softness of your touch encourages circulation, how your posture protects the delicate structures that support erections, and how your nervous system responds when you guide the process instead of rushing through it. The nights that once felt unpredictable or frustrating gradually become calmer. You fall asleep with a sense of balance, not exhaustion, and you wake up with more energy, more clarity, and a feeling of ownership over your sexual health. And it goes beyond the physical. Improving how you touch yourself changes how you relate to your own masculinity. It restores confidence that may have been fading quietly. It brings back a sense of presence and strength that often gets lost in the noise of aging, stress, or routine. When you understand your body, you stop fighting against it and start working with it, and that creates a ripple effect that touches every part of your life. Better sleep leads to better mood. Better erections lead to better connection. Better awareness leads to better choices. By now, you have a clearer picture of how small nightly habits can shape your long-term sexual health. And if you reached this point in the video, it tells me something important about you. It tells me you care about your body, your confidence, and your future as a man. So before we wrap up, I want to offer something simple, something natural, something that matches the tone of everything we built together here. If this conversation helped you understand your body better, consider subscribing so you can keep receiving guidance that supports your health in a real, practical way. And if you want to let me know you stayed with me until the end, leave a comment saying something like "This message was for me." It helps me see you, and it helps you stay committed to your own progress. If you feel that this journey made a difference for you, a like on this video is always appreciated. And if you want to keep building on what you learned today, there is another video right here that continues this conversation in a way that complements everything we talked about. Click and follow me there so we can continue improving your sleep, your erections, and the way you feel in your own skin.